This video is to help you learn more about the Ottawa Charter for Health Promotion and how it can be used to promote health in Australia. We'll go in detail into the 5 action areas of the Ottawa Charter and then break down the key skills for this particular topic to make sure you are feeling prepared for your SACs and your exam. So let's start by going in a little bit deeper as to why this particular framework was developed. So in 1986, there was an international conference held by the World Health Organization in Ottawa, which is in Canada. So, what this meeting was held for was in response to the social model of health. As you would have seen in my previous videos, when we've spoken about the social model of health, there was that shift to health promotion away from just that biomedical approach. But what needed to happen was that the social model and that shift to health promotion and prevention meant that there needed to be specific guidelines that needed to be developed in order for stakeholders and organizations to incorporate these health promotion strategies into their policies and campaigns. Because prior to this, there was no framework guiding any organization on how to embed this and how to implement health promotion strategies. So, therefore, that was the need for the Ottawa Charter to be introduced as a framework was needed. And this was really, really important because organizations really needed that framework to make sure that their health promotion strategies were going to be effective. So, building on our last slide, if we were asked to define the Ottawa Charter for Health Promotion, it is an approach to health that was developed by the World Health Organization that aims to reduce inequalities in health. So, really, it was introduced to help reflect the social model and complement the social model, and provides 5 action areas that can be used as a basis for improving health status. So, again, those action areas are the framework to ensure health promotion is effective. So, before we get into the action areas in more detail, as they're going to be the prominent sort of key knowledge and skill that you need for your assessments and your exam, let's have a look at the Ottawa Charter strategies. So, the Ottawa Charter is centered around these 3 strategies for health promotion, which are enabling, mediating, and advocacy. So, these strategies focus on ways in which health promotion programs can be introduced. So, let's go into each one in a little bit more detail. So let's start with advocate. So this strategy is referring to actions designed to gain support from governments and societies that are necessary to improve health and well-being for everyone. So an example of this is like a social media or media campaign to help promote a health program. So advocate is really, really important because it's advocating for a particular health issue or health promotion program. The second one is enable. So, the real focus of this strategy is around achieving equity, really focusing on those vulnerable population groups. This isn't really important as we know these groups experience differences in health status, and providing these equal and fair opportunities for these population groups is really, really critical. So, some examples of this, it includes access to education, employment, adequate housing, nutritious foods, and healthcare by empowering people. So, the second kind of part of that is around empowering people. So, we know through our work with the social model that empowering people is very important so that people can take control over their own health and factors that influence their lives. So, that's the focus of this strategy and that key area of the Ottawa Charter. And our last one is mediate. We know that health promotion requires funding. Even though it's not as expensive as the biomedical approach, the initial investment of health promotion programs is a lot, but then the idea is that it is not going to be as expensive long term because it's really going to prevent those illnesses and conditions by improving overall population health. So the focus of this is around changes to legislation and policies, and then adjustments to the physical and sociocultural environment. So in doing this, it can cause conflicts and disagreements between groups. So this strategy really focuses on promoting positive outcomes for all and having a clear objective so everyone is aware of what the goal is and they can work together in order to achieve that. So, these are the 5 action areas of the Ottawa Charter for health promotion. There is an acronym that it may be useful for you. It's Bad Cats Smell Dead Rats. really lovely one for you. But yeah, if that helps you learn, and even when you get a case study or a question on the Ottawa Charter, if you just write that above the question, if that's going to help you, then please do that. So the first one, B, build healthy public policy. C, create supportive environments. S, strengthen community action. D, develop personal skills. And R, reorient health services. So we will unpack these more in the next few slides. Okay, our first action area, build healthy public policy. So this action area is really focused around decisions made by the government or organisations regarding laws, legislation and policies. So the real aim of this action area is to make unhealthy choices for the general population more difficult, and doing that by focusing on making improvements to overall health and well-being. So anything that you can think of that's a law or a policy or anything like that that has been introduced to help improve health and well-being, then that's an example of build healthy public policy. So again, if you're getting a case study and you have to draw that information out, you'd be looking for a particular law or policy from a government or organisation. So some examples here include seatbelts. So the aim there is to, and speed limits as well, to reduce road trauma and injuries. The tax placed on cigarettes, so a higher price is going to deter people from smoking, so reducing smoking rates and therefore lung cancer and all of the other conditions that come along with smoking. And also the no hat, no play policy. So this is to enforce being sun smart and therefore reducing the impact of UV rays for children in particular with that policy. But then we know later on in life, reducing that incidence and prevalence of skin cancer as well. So they are all examples of policies that have been brought in some shape or form that have been trying to make it more difficult for people to make those unhealthy choices and to improve their overall health. So create supportive environments. This action area is really relating to our physical and sociocultural environment that help to make healthy and easier choices. So an example relating to our physical environment could be local governments installing more walking or biking paths in local communities, as that's going to promote and encourage physical activity. So that's a change to make a physical environment more supportive and giving people that access to make that healthier choice. An example relating to the sociocultural environment is if you had, for example, a person who may be struggling with alcohol consumption and have issues with alcohol, then a family on a celebration like Christmas or a birthday could have an alcohol-free celebration that could help someone with an alcohol addiction. Because again, that's showing that's creating that environment that particular person is going to be able to feel more comfortable, and also going to enable them to make a healthy choice around reducing their alcohol consumption as well. I actually recently saw a question about the action areas of the Ottawa Charter and how it could be used to reduce sugar consumption in children. So an example of that from a sociocultural perspective could be around the support of a family. So parents could educate children about different foods, and as a family cook meals together that are low in sugar. So that's an example, as it's a supportive family environment. And again, for if we're relating it back to that question with children, then it's going to enable that child to make a healthier choice. Strengthen community action. So this action area is around involving and encouraging people from all parts of the community to work together to promote health. So the real focus here is on building those links between the community and the individual and having common health and wellbeing goals. An example of this is the provision of Indigenous health services. So when there's Indigenous health service, it would usually involve Indigenous people running and helping with the service, which is showing a connection within the community and making sure that they're involved with that as well. Another example is a local community who may want to improve the consumption of fruit and vegetables. So they could come together and have a community garden so people have access to this food. And have access to growing food and having that healthy food as well. So really, if you get a case study and it's around multiple sort of stakeholders coming together and multiple groups coming together towards a common health and wellbeing goal, then that's going to be an example of this action area of strengthen community action. Because really, it's just around individuals, the community coming together, and multiple stakeholders as well. The next one is develop personal skills. Now, I feel like this one is maybe more of one of the easier ones to remember. It's around giving people the information, knowledge, and skills to make healthier choices and really take control of their overall health. So, this action area really focuses on educating people across many different settings, so home, school, work, etc., and giving them the knowledge and skills to make positive choices regarding their health. So, examples of developing personal skills may be cooking classes, teaching about food portions and nutrients, teaching women how to check for breast cancer, or teaching people how to write a fitness plan to improve their cardiovascular health. So, again, if you got a case study, that particular skill, which we'll go over a little bit later, if you see anything around education and skills or knowledge, then that's going to be an example of this action area. So anything that's relating to education and skills in terms of improving their health, then that's going to be develop personal skills. All right, so our last action area is Reorient Health Services. So this action area really focuses on changing the health system so that it promotes health and well-being rather than just focusing on diagnosing and treating illness. So really moving away from just that biomedical approach. It has a strong focus on medical professionals taking a preventative and health promotion approach. So, an example here would be if a patient attended a doctor's clinic, say presenting with asthma and difficulty breathing, but they report that they are a smoker. If the doctor discussed with the patient a plan on how to encourage them to quit smoking and the benefits of this rather than just treating the asthma, then this is an example of reorienting health services as the focus is on prevention and health promotion. So, a question that commonly comes up, like again, if I'm referring to case studies, really need to look at like organizations or medical professionals that have taken that preventative approach there for the focus of this action area. So that would be what you're looking for in a case study. So that is a snapshot of the content for this particular topic. But what is the actual key skill for this? So the key skill is apply the action areas of the Ottawa Charter for health promotion to a range of data and case studies. So the first step in this is you really need to know how to describe in detail the 5 action areas of the Ottawa Charter, as you can't apply your knowledge unless you have an understanding of what each one of those are. And there will be questions where you might be asked to identify and describe the action areas. So having a really good sentence that you can remember that helps demonstrate your knowledge of that action area is very, very crucial. And that would be step 1. The second part of this skill is giving evidence of Ottawa Charter action areas within case studies and really analysing case studies in depth. So this is very similar to what we have looked at on the social model, where you are given a case study and you might be asked to identify action areas of the Ottawa Charter and explain how they're evident in the program. So again, being able to give that evidence to a high standard and high quality to get those full marks is really around you need to know what those action areas are. You need to draw that out of the case study using a specific example, but then tie it back into showing your knowledge and evidence of what that action area actually is. Because if you draw, it's very easy to just choose an example from the case study, but if you haven't linked it correctly back with that knowledge of what the action area actually is, then you're probably not going to be eligible for full marks for that question. So that just comes with practice and practicing those case studies, practicing drawing out that explicit information and applying your knowledge. And then the last part of this is applying your knowledge of the action areas to explain how they could be used to improve or reduce certain areas. So again, there was a question on an exam, I think maybe it was a 2019 exam, where the action areas needed to be used around sugar consumption, but you could get anything here. So it could be to reduce childhood obesity. It might be around how could the action areas be used to improve road trauma, really anything. So for this skill, I would say this is probably the most complex part because it really is that higher order application type question where you need to have that really solid understanding of what the action areas are and know how they could be used for different illnesses and diseases, whatever it is in the question. So we'll go through an example of that. So let's look at our first key skill in action here. So this is a case study from the 2018 VCA end of year exam that is simply applying your knowledge of the Ottawa Charter and using that analysis in terms of looking through the case study and choosing an action area and giving that evidence. So again, I've got the marking breakdown on the side there. So this is a 6-mark question. So you're getting 1 mark for identifying each action area, another mark each for describing the action area because it's asking you to identify and describe the action area, and then 1 mark for each example of showing that evidence of the action area with the links to the case study to support your answer. Okay, so this is again, the first 2 marks should be really simple. So identifying and describing, that should be something that you have practiced through flashcards, anything like that, and have those definitions ready to go. So I'll just read out the first example. So I've got create supportive environments. A supportive environment provides opportunities for individuals to build socially and culturally sensitive manner that promotes health and well-being. So then I need to give an example or my evidence from the case study to support what I've just spoken about. So the program is coordinated by Peninsula Health, provides a space to meet and have a chat between community members in a culturally friendly environment, and therefore reflects a supportive environment. So I've got that specific example from the case study. I have then linked it back to, well, therefore it reflects a supportive environment. So it is really going back to showing that knowledge of this is the example I've chosen, this is why it reflects a supportive environment. And then I've got my second example down there as well. But hopefully that those marks can show you, I think it's really easy if you get to identify and describe that you might miss the describe part. So really, again, that comes down to after you're using your reading time appropriately, highlighting those keywords so you're not missing out on those easy marks. So this is that, I guess, third part of that key skill, which I think is more complex than the case study one, in my opinion. But this is a sample question. This was the one I was just thinking of before. So it was around alcohol use. So the harmful use of alcohol is one of the leading risk factors for population health worldwide. Discuss 2 action areas of the Ottawa Charter for Health Promotion that could be used to address increased rates of alcohol consumption. 6 marks. So here it is around, they are looking for your explicit knowledge of the action areas, and it is really you digging deep and applying your knowledge of what they are and then applying it to increase rates of alcohol consumption. So I've got the marks on the side there. You'll notice that because it's a discuss question, you need to have 2 examples in there. If you just had 1 example in each, I would say you'd probably get around 4 marks there. So discuss is really, you need to have an in-depth discussion, like the skill word is telling you to. So the first one, I'll just read out one example. But the first one I chose was build healthy public policy. So governments can raise tax on alcoholic beverages, decreasing the attractiveness of buying the alcohol to many conscious buyers as they are made too expensive. Therefore, this is decreasing rates of alcohol consumption. I now need to give another example. The government can also place laws on how many drinks are allowed to be bought from a single customer, for instance, at a bar. This would decrease overall alcohol consumption. So that example is showing that I understand what Build Healthy Public Policy is because it's around governments and legislation and also laws and policies that can be passed to achieve a certain health and wellbeing goal. And again, going back to that action area is around making unhealthier choices more difficult. So that has linked really well back to the question there. Then I've got one there for create supportive environments. Again, making sure that your example is super specific and it does actually relate back to the action area that you have chosen. Because some of the answers that I've seen in the past for questions like this is that someone might say create supportive environments, but then start talking about education and skills, which is then develop personal skills. So you just need to be really selective with your examples, make sure that they are, believable and they make sense and they do link back to your action area. Okay, so now it is your turn to practice some of these key skills in action. So have a go at completing these 2 questions here. that give you, I guess, a snapshot of both of those aspects of this particular skill. So question 1, explain how 2 action areas of the Ottawa Charter could be reduced to reduce death rates from cardiovascular disease. So 4 marks. So again, there you would need to have 2 action areas and they must link back to cardiovascular disease. Because it's 4 marks, you only need 1 point for each, not like that question that we've just practiced on the previous slide. And then question 2, identify 2 action areas of the Ottawa Charter and explain how they are evident in the Walk to School program. 2 marks for identifying, 2 marks for giving that evidence and making sure that you are linking it back appropriately to each of your action areas. Thanks for watching this video on the Ottawa Charter. If you have any questions or need anything else further explained, please just pop a comment in the comment section. And I hope this has helped you and your understanding of this topic.